Hello viewers, I'm Dr. Harsh. As we were discussing the sinuses of the pericardium, so we have two sinuses, transverse sinus and oblique sinuses. What are sinus actually? It is the potential space. So this potential space is in the serous pericardium, right? So in intervisceral space is called transverse sinus and tritovisceral space is called oblique sinus, right? Tritovisceral space is oblique sinus, intervisceral space is transverse sinus. Now let's explain in detail what actually this means. Now, during the development of the heart, we have two heart tubes. One is the arterial end, one is the venous end, right? Arterial end includes aorta and the pulmonary trunk, and the venous end includes the superior and inferior vena cava and four veins, pulmonary veins, which line the left atrium, right? So this is right atrium, this is left atrium, right? This is the superior view of the heart. Atrium lies above the ventricles. So this is the right atrium, this is the left atrium, right? So the potential space between the arterial and the venous end, this arrow, this is the transverse sinus, means in between the aorta and pulmonary trunk and superior inferior vena cava and the four pulmonary veins. This space is called the transverse sinus. Now the oblique sinus. What is oblique sinus? Oblique sinus is actually the cul-de-sac behind the left atrium. So this is the left atrium, this space, this arrow, this is the oblique sinus, right? It lies within the limbs of the inverted J-shaped attachment of serous pericardium. So serous pericardium, in fact the visceral layer of this pericardium. So it is an intervisceral space, pritovisceral space, sorry. It's a pritovisceral space. As in the above diagram, let's see the attachments of this, boundaries of this oblique sinuses. In front we have left atrium, behind we have, in front the left atrium, behind we have parietal layer covering the fibrous epithelium, right? Covering the fibrous pericardium. On the right side we have right pulmonary veins, on the left side we have left pulmonary veins, right? This, and below it is open. Open means below it forms the cavity, as in already discussed in this diagram, right? This is the cavity. Below we have this fibrous pericardial cavity, oblique sinus, right? This is nothing but oblique sinus. So let's revise. Transverse sinus is the potential space between the arterial and venous end, and the oblique sinus, it is the potential space behind the right atrium. It means anteriorly we have left atrium, not right atrium, this is the left atrium. Posteriorly we have the parietal layer of the fibrous pericardium. Right side we have right pulmonary valves, left side we have left pulmonary valves, right? Now one more thing is important here. I have written here, this is a fold of Marshall, right? Now what is this fold of Marshall? This fold of Marshall is nothing but is a triangular fold of serous pericardium which extends from left pulmonary artery to the left pulmonary vein, right? From left pulmonary, the base of this is free. It contains what? It contains actually the remnant of the left duct of Cuvier, right? What is fold of Marshall? It is the space or fold of the pericardium between the left pulmonary artery to the upper left pulmonary vein, right? What does it contain? It contains fibrous remnant of left duct of Cuvier. What is this left duct of Cuvier, right? It is nothing but, we had developmentally, when we the development of this inferior vena cava and superior vena cava, we have different cardinal veins. So this left duct of Cuvier is nothing but the left cardinal vein, right? So fold of Marshall is also called fold of left vena cava, right? What is fold of Marshall? It is fold of left vena cava, which means it is a triangular fold of serous pericardium which extends from the left pulmonary artery to the upper end of the left pulmonary vein. The base of the fold is free and directed towards the left. It contains remnant of left duct of Cuvier, which is what? Which is cardinal vein, common cardinal vein, left common cardinal vein, remnant of the left common cardinal vein or left duct of Cuvier, right? Which is continuous above with the terminal part of the left superior intercostal vein and below with the oblique vein of the left atrium, right? Now one more diagram is here, this one, which explains the transverse and oblique sinus, right? These both are the arterial ends, pulmonary trunk and ascending aorta. So this one is transverse sinus, right? Now what is this? Pulmonary veins, left and right, right? So this is right atrium. Behind the right atrium we have the potential space, which is oblique sinus, which is continuous below as the pericardial cavity, as shown in the previous diagram which I showed already. Below it is continues into the pericardial cavity. Okay. Now, what is the clinical importance of this transverse sinuses? Transverse sinus, the clinical importance mainly is like during the cardiac surgery, right? A ligature may be passed through this transverse sinus around the aorta and pulmonary trunk to avoid bleeding or to avoid the hemorrhage. Then we have paracentesis, means this pericardial cavity which I have shown pink color. The normal fluid accumulation is 300 ml, right? When the fluid is more, accumulation of fluid in this cavity will compress the heart and will lead to diminished cardiac output, right? For this purpose we do paracentesis, means aspiration of that fluid. So for that we have to insert a needle through the costoxiphoid angle, left costoxiphoid angle, right? And fluid is aspirated. One more route is there where we give intracardiac injection. That route is the left fourth or fifth intercostal space, immediately lateral to the sternum, right? So that will through this route we can give the intracardiac injections. Now last but not the least, we have blood supply of this pericardium is by internal thoracic, musculophrenic and descending thoracic aorta of both the parietal pericardium as well as fibrous pericardium. But the visceral pericardium, it is supplied by the, as already written, by the coronary arteries. Okay, and the veins drain into the corresponding veins. Now the nerve supply. Nerve supply, parietal and fibrous pericardium, they are supplied by the phrenic nerves, while the epicardium, or epicardium is another name for visceral pericardium. Visceral pericardium or epicardium, which is supplied by the autonomous nerves. Now, one applied is related to its nerve supply. Normally the heart is not sensitive to pain, but if the cardiac pain is there, that is due to carditis. Pain is felt in the parietal pericardium because it is supplied by phrenic nerve, right? Due to pain in the parietal is felt in the parietal pericardium. Now the angina pain, that is because of the pain which is first felt in the musculature, right? Now we have another topic, heart, external features of the heart. Now first let's discuss about the heart. We have two atria and two ventricles for the heart, right? So it is a hollow organ, conical. I already tell you, it is in the human cadaver, or we can say in the living, we have the size of the heart is the size of our fist. It is that shaped, right? It consists of four chambers, we already know, right? Right and left atria, right and left ventricles. The atria are separated from each other by interatrial septum, and the ventricles, they are separated from each other by interventricular septum. Right atrium receives deoxygenated blood by superior and inferior vena cava and by coronary sinus. Then the blood enters the right ventricle from the right atrium through right atrioventricular orifice. Then ejected to the pulmonary trunk, where the blood reaches the pulmonary circulation or pulmonary capillary plexus for oxygenation. Left atrium receives the oxygenated blood by pulmonary veins. From the blood enters the left ventricular through left atrioventricular orifice, and then injected into the ascending aorta for distribution into the whole body. So in this way the heart deals with deoxygenated blood, right one, and the left heart deals with the oxygenated blood. So left one is for systemic circulation, right one is for the pulmonary circulation. Okay, now we discuss the heart by apex, base. It has three surfaces, it has three borders. Now let's start with the apex. As I have drawn the sternocostal surface. Sternocostal surface means anterior surface. This surface is the I have drawn the sternocostal surface. Sternocostal means towards the sternum, anterior surface, right? Now apex, what is the apex? It is a conical, this is the apex. Apex is directed downwards and it is formed only by the left ventricle. So this is right ventricle, this is left ventricle, right? This is right auricle or atrium, this is right atrium, left atrium, right? This is left ventricle, this is right ventricle. This is auricle, left auricle, this is right auricle. Atrium lies behind the atria, both of the atria lie behind these ventricles. So there is the atria part is not visible here because it is occupied by these vessels, pulmonary trunk and arch of aorta, pulmonary trunk and arch of aorta, right? So these two are ventricles. This is auricle visible here, atrium are behind this, right? So this is the sternocostal surface. Behind the surface, that is the base which contains two atrias, and that inferior will be the diaphragmatic or inferior surfaces. So three surfaces are there, right? And this one is here is the left surface. Now apex, we are discussing about the apex. Apex is a conical formed mainly by the, देखो apex कौन से side पे आ रहा है? Left ventricle. So apex is mainly formed only by the left ventricle and is directed downward, forwards and towards the left. In the left fifth intercostal space, we have already, you people must be knowing, we feel the apex beat at left fifth intercostal space, right? About 9 centimeter from the midline, right? But in children, it is usually in the fourth intercostal space or just lateral to the midclavicular line, right? In 2 years, it reaches the adult position. This is all about the apex.